Good morning. My name is Jeffrey Halbrecht, and I'm the CEO of ZKR Orthopedics. ZKR stands for Zero Knee Replacement, and our mission is to provide a minimally invasive alternative to knee replacements for patients with patellofemoral arthritis of the knee. And we do that by unloading and realigning the patella, therefore preserving the joint rather than needing to replace it. Patellofemoral arthritis is an enormous problem. 70 million Americans report having patellofemoral pain, and up to 1 million Americans actually show up for medical treatment for patella cartilage wear and patella pain every year. Currently, there are just no existing good solutions for patellofemoral arthritis. Most patients currently are treated with anti-inflammatory medication, use of a knee brace, they're told to lose weight. Sometimes they'll get a cortisone injection or some other type of injection therapy. A very small number go on to get a cartilage graft, but the vast majority go on for decades being told just to wait until they're old enough for some more invasive procedure or late-stage intervention, such as an arthroplasty. So how do we come up with the idea of a patella unloading device? There's actually a surgery called the tibial tubercle osteotomy, or TTO, that does unload and realign the patella. But it's done very uncommonly because it's very invasive, as you can see from the photo. Patients are on crutches for 6 to 8 weeks or needing a knee brace for 6 to 8 weeks. It's a very painful procedure. There's a high rate of complications, and up to 40% of people go on to need a second surgery to remove hardware. So we felt there had to be a better way. The ZKR lift implant unloads and realigns the patella without having to cut bone. It's a minimally invasive procedure. We have a PEEK implant that goes behind the tendon and realigns the patella through the soft tissues rather than having to cut bone. It's fixated to the tibia using 3 titanium screws. It's a minimally invasive procedure. The typical incision is about 1.5 inches. The average surgery time was 25 minutes in our first in-human study. The patients are allowed to immediately weight bear, it's reversible, and the cases are all done outpatient at an ASC. So how does the ZKR implant unload the patella? On the left is a side view of the knee. You can see the implant lifting the tendon, which tilts the patella up and away from the area of wear and discomfort. And on the right is a bent knee view showing the slope of the implant, lifting the lateral side of the patella and shifting and realigning it, again, unloading the area of cartilage contact where the arthritis is causing pain. This is an MRI example of one of our patients in our current IDE study. On the left, in blue, is outlined the patella tendon, tilted and out of alignment. On the right is after we've inserted the patella lift implant, which shows elevation and realignment of the patella tendon, thus unloading the patellofemoral joint and relieving pain. This is an enormous market. We've calculated there are 600,000 patients annually that are eligible for the lift implant. With an average selling price of $6,000, it's a $3.6 billion market potential. And there are existing reimbursement codes, which I'll discuss in an upcoming slide. Our average selling price of $6,000 that we've calculated is based on existing comps. There's a typical price for a primary knee implant is $4,500 to $6,000, and for revision implants and more complex implants, it's quite a bit higher. MoxyMed sells their medial unloader device for an ASP of somewhere between $13,000 and $15,000. So we believe $6,000 is a reasonable anticipated price for our implant once it comes to market. And this provides very high margins given our current cost of goods. What about reimbursement? So there are existing codes that are applicable to our implant right out of the gate. There's a code 27422, which is used commonly for patella realignment. I'm an orthopedic surgeon. I've used this quite a bit. It reimburses at a high rate, both for the physician and for the facility. And there are existing concomitant procedures that also add on to the reimbursement for that procedure. These are done arthroscopically at the time of the surgery to remove cartilage debris from behind the patella, remove loose bodies, release tight tissue that's holding the patella out of alignment called a lateral release. Adding these all together, again, is a very attractive economic situation for both the surgeon and the facility. What about intellectual property? So ZKR was the first to file any patents in this area for patella realignment procedures, and we're the only company that's actively expanding our IP portfolio in this space. We have 6 issued patents in the US and Europe, both for the device and method, and 7 pending applications. We performed our first in-human trial in Europe. We had 18 patients for 24-month follow-up, And we measured pain based on VAS scores and function based on the Kujala anterior knee pain score. And we showed quite significant reduction in pain and improvement in function in our first-in-human data. And importantly, we had excellent safety data. We had no patients progress to partial or total knee replacement. We had no damage to the tendon, no necrosis, no tears. There was no stretching of the tendon. And we had no hardware failures or surgical complications. And the average surgical time, again, was under 30 minutes. We have some patients in that original study that are now out past 4 years, and we still have no patients that have converted to total knee replacement. Here's some examples. On the left is a 61-year-old gentleman, a little bit more than 2 weeks post-surgery, doing assisted knee squats with no discomfort and early recovery. On the right is a 42-year-old gentleman, 5 months post-surgery, able to do deep, heavy weighted squats, again with excellent function and improvement over his preoperative status. These patients do not complain of prominence from the implant, as you can see with that hyperflex knee view. They don't lose any range of motion. We had all the patients kneel on the knee. They don't complain of pain from the implant. And as you can see on the lower right is a very small incision with a small scar. So currently, we have initiated our IDE pivotal trial. This is a non-inferiority trial design comparing our Lift ZKR implant compared to that bony procedure, the TTO, or tibial tubercle osteotomy. We have 9 patients enrolled. We'll have 10 by the end of the month. And our early data on the patients who've come back for data collection show a 60% improvement in pain and a 52% improvement in function. Importantly, we also showed no complications in our current study, which is similar to our first-in-human, and again, excellent improvement in pain and function. So how does the ZKR Lift do against the TTO? We have not started enrolling our control group as of yet, but there's lots of literature on how the TTO procedures do. So looking at VAS pain and functional improvement, we show 60% improvement in pain in our current IDE study compared to 35% in the TTO literature, and for functional improvement, 52% versus 47% in our early data. Now, our study is designed as non-inferiority, but our current data suggests that we may actually wind up being superior to the TTO, which is our control group. So what is our timeline? We did our first implant in September of 24. We're going to be enrolling this entire year and anticipate enrolling potentially through early 26. We need a 2-year follow-up for FDA approval and anticipate submitting for de novo 510(k) approval and FDA approval in 2028. We're raising a Series B of $20 million to help us complete our IDE trial, get to FDA device approval, and some early pre-commercial activities. I'd like to point out that we've been extremely capital efficient, having spent only $5.4 million to date to get where we are. We have a very experienced team with an average of 30 years of experience across all areas of our company, helping to guide us to that endpoint. So in summary, patellofemoral arthritis is an extremely common problem. 1 million people a year show up for some sort of treatment for patellofemoral arthritis currently in the US alone. The market size is $3.6 billion potential annual revenue with high gross margins based on our current cost of goods. Our clinical trial data looks quite excellent and is consistent with our first-in-human data. We have existing reimbursement codes that we have been advised from reimbursement specialists is applicable right out of the gate for when we can commercialize our implant. And again, we are raising a Series B of $20 million to get us through our IDE and to get to FDA approval. Thank you very much.